YouTube. So.
Yeah, you can go.
You're on now.
Yeah, you're live.
Okay, fantastic. Thank you, everyone. Welcome to our audience in person and also online. I'm Professor Emma Koval from the Science and Society Network, and I'd like to begin by acknowledging the traditional owners of the land in which we're meeting today, the Wurundjeri people of the Kulin Nations, and pay respects to elders past, present and emerging. We are so pleased today to have Nikita Simpson visiting us from SOAS at the University of London. I'll introduce her and I'll introduce our two discussants before we hear from Nikita. And then after her presentation, we'll just have around 5 minutes of discussion from our two discussants to get things started off, and then we'll have plenty of time for questions. So please do make a note of questions that you have. For those in the room, you can, in person, indicate that you want to ask a question. For those online, for those watching on YouTube, please do take this opportunity to introduce yourself in the chat, say hello. Karina Traits, our amazing coordinator, is there hosting on the YouTube chat. And if you do have any questions as we go through, you can just pop them in, questions or comments along the way. And then Karina will help to read out those questions when we get to the Q&A. So I think we are ready to introduce our speakers. Have I forgotten any housekeeping? I don't think I have. Oh, and I should just say, this is going to be so exciting today. And if you want to make sure you don't miss any other Science and Society Network events, please do subscribe to our newsletter. You can just Google Deakin Science and Society Network, and you can find our webpage, and at the bottom of that, you can subscribe to the newsletter. We are also on LinkedIn. Follow us there, and you'll also you'll keep up with any events. Okay, so I will love to invite. Actually, I'll introduce our speaker and then the discussants. So Nikita Simpson is a reader in anthropology at SOAS at the University of London, and she is co-director of the Centre for Anthropology and Mental Health Research in Action. She researches, develops interventions and provides policy advice on mental health care and inequality. Her PhD thesis was on embodied forms of illness and mental distress amongst Gadi tribal women in Himalayan North India. And her PhD work has been awarded numerous prizes. And she is very well published. And a really important part of her work is, as well as academic publications, she has written a lot of reports and policy briefs. She's made a participatory film on Somali women's experiences of COVID-19 in Birmingham that she co-directed. I think the work that we'll hear today is in collaboration with a psychotherapist, Suad Duale, and she works with Suad on the ways in which encounters with mould, disrepair and state discipline in temporary accommodation generate particular forms of racial trauma. And she's also involved in other projects, some on ecological distress in the Himalayan region, and also the large Australia Cares project. So you can ask her about those other ones afterwards for those in person, lucky enough to be here. But we'll be talking today about hostile environments, housing policy, mould and illness in diasporic communities. So just before we get started with the talk, I'll just introduce our discussants. So we have Cenk Sofioglu, who is Associate Professor of Biomedical Science here at Deakin with us.
Thank you
so much, Cenk.
Karina.
Cenk is a scientist that looks at allergies and the links between allergic disease and neurodegenerative disease in his neuroallergy research laboratory. He is famous for thunderstorm asthma. You didn't cause thunderstorm asthma.
No, I just coined the term many years ago.
Yeah.
And detected it.
So, yeah, we have him to thank for understanding of that, which is a really important public health issue, particularly in Melbourne. And he is doing really exciting work on epigenetics and its role in human neurodegenerative disease and links with allergy. Really exciting work.
Thank you, Emma.
You're welcome. Thank you for being here. And we also have Marty Regan-Smith, Dr. Marty Regan-Smith, who is a research fellow in the Deakin Institute. She is an environmental anthropologist and early career researcher interested in human environment relations, political ecology, intercultural relationships in settler colonial contexts, and visual anthropology. And also a very good filmmaker as well. She is a research fellow here, and her work is looking at environmental management, both inside and outside of formal conservation structures, Indigenous settler relations, human-plant relationships, in terms of invasive species and medicinal plants. So we have two really amazing discussants who are going to be responding in very different and complementary ways. So, Nikita, I will hand over to you. Do you want to slide?
Yeah, that would be great. Fantastic. Thanks so much, everybody. I'm so delighted to be here. And, I'm from Australia and I'm from Sydney, and I've never given a paper here in Sydney, here in Melbourne, but here in Australia. So I'm so delighted to be here, to be engaged in this incredible network where I've already begun to have generative conversations. And I've already learned things even over lunch. So I really look forward to deepening my understanding of kind of different ontologies of mould, I think, through engagement with brilliant colleagues. But here today, I'm going to give a paper on behalf of a couple of my incredible colleagues. All of this research has been deeply collaborative already, though not yet with scientists, with Dr. Elizabeth Storer, who's a geographer at Queen Mary University of London, Dr. Suad Duale, who's a psychotherapist and Somali community activist, and Dr. Ella Hubbard, who's an NHS clinical doctor. So what I present today is part of a 2-year activist research project that grew out of encounters that we had with Somali mothers in the UK Midland city of Birmingham during the COVID-19 pandemic. And it actually grew out of engagements around the film that Emma mentioned that Suad and I did together, which you can look up on YouTube. When we first met these mothers, they came forward to us to tell us that they were homeless. At first, we were struck, but they weren't rough sleeping. Through 18 months of fieldwork, including dozens of testimonial housing biographies, home visits, and 4 creative psychotherapeutic workshops, we came to realize that homelessness was a wider material reality of being continuously evicted, moved between temporary accommodations, and forced to live in houses in serious disrepair. But it was also an existential condition, an experience of protracted displacement that spanned their lifetimes as refugees and spoke to intergenerational experiences of coloniality and trauma. So what I present today is a small tranche of this work, focused particularly on the encounters that Somali women had with mould in their insecure houses and as it affected the bodies of their children. It's a very early draft of a paper whose shape is still emergent, so I really look forward to comments and reflections from my esteemed colleagues. So I'll begin with the story of Awa. You can see the film here. Okay, let's see if I can play this. See that green and black on the walls? Awa pointed to the festering kitchen wall. That is what my children's lungs look like. Awa, a single Somali mother of 8 living in the UK city of Birmingham, uttered these impassioned words during a visit that we made to her home. The mould, she showed us, was not located only in one area of the house. It didn't just creep up the shower tiles or cluster along the inner seal of the door frame. The mould was everywhere. When Awa moved into this house 3 years ago, she was thrilled to finally be in a home of her own. The rent was steep, but she was willing to pay it to provide her children with enough space to be able to sleep in their own beds, play and do their homework in peace. She decided to move from Sweden to give her children the chance of building a life in a country that allowed them to practice their religion and Somali culture freely, something that she had found restrictive in the Scandinavian countries where she first sought asylum. She left her husband behind and found this house in Birmingham. She took up 16-hour shifts as a care worker to pay the rent. At first, the house was freshly painted white and seemed clean. However, in the coming days and weeks, black spots began to appear. She tried to clean them, to paint over them, but they kept coming back. I didn't know what was behind, she sighed. Soon her son started to get sick with asthma and eczema, and she developed a cough herself. Awa was just one of the Somali mothers living in the UK Midland city of Birmingham who experienced conditions of mould and disrepair in their private or government-provided accommodation. Indeed, she is one of the many people across the UK who live in such conditions. In 2020, 3.5 million occupied homes in the UK did not meet decent home standards, 941,000 because of serious damp. This accounts for 4% of England's total housing stock. But this headline national figure disguises wide variations by tenure type. Private rented houses are 5 times more likely to have damp as those that are owner-occupied, and aged properties are disproportionately affected. Disrepair, poor insulation, fuel poverty, and overcrowding converge to generate environments where mould flourishes. Viewed from the structural level, mould is an endemic problem in the UK's housing system, a symptom of deregulation in the UK's private housing sector, and of divestment in public housing stock. Awa's complaints and those of other Somali women that our research team met over 2 years of ethnographic fieldwork exemplify this wider structural problem. Their stories speak to a wider public narrative that surrounds mould's harmful public health effects that have gained both public and political attention in Britain in recent years. Public mobilisation around mould partly stems from the heavily publicised coronial inquest following the tragic and preventable death of 2-year-old Sudanese British boy Awab Ishaq in December 2020. Ishaq died, according to the Coronial Prevention of Future Death report, as a result of a severe respiratory condition due to prolonged exposure to mould in his home environment. Action to treat and prevent the mould was not taken. Ishaq's death prompted increased public health awareness of mould as a toxic substance, rather than only an allergenic or irritant substance. In the lead up to the most recent 2024 election, mould was mobilised as a symbol of Tory governmental failure, used to evidence the harmful effects of austerity policy, state abandonment and inequality. For opposition politicians, academics, activists and artists, images of mould in public media work to build political solidarity and civic consciousness of the harms of more than a decade of austerity policy. In this public narrative, mould is indicative of class inequality that is resultant from the UK's neoliberal capitalist system. However, the accounts of our Somali interlocutors also complicate this public narrative by insisting on the particular embodied racial inequalities that are generated through domestic encounters with mould. Those living in the UK under migrant or refugee status or post-colonial citizens were often described as hailing from BAME or Black and minority ethnic groups, disproportionately rent rather than own housing, and disproportionately reside or are placed by the state in substandard dwellings. For these groups, mould also renders the UK government Home Office's hostile environment approach, a set of administrative and legislative measures introduced in 2012 aimed at making it difficult for migrants to stay in Britain, the literal experience of the domestic world. In encounters with mould, securitised migration policies that promote internal colonisation are continuous with the racialised ideologies of deservingness that characterise housing policy. As the material in this paper reveals, our Somali interlocutors decried the ways in which mould was blooming in their private or government-owned houses, damaging the lungs and skin of their children, making them sick with asthma and eczema, and causing them psychological distress, sleeplessness, and depressive symptoms as these mothers laboured to eradicate it. They also decried the ways in which local authority officials often blame Somali bodies, breath and sweat, and cultural practices, uncleanliness, childbearing and rearing, ritual bathing, for generating the conditions that were making them sick. They contextualized their encounters with mould in longer biographic accounts of housing distress that included present experiences of statutory homelessness and temporary accommodation use in the UK, and past experiences of protracted displacement as refugees from Somalia and in the European or Scandinavian countries in which they first sought asylum. Many of the harms that they cited in these accounts, colonial dispossession, racial discrimination, hate crime, stigma at the hands of migration officers, housing officers, and healthcare workers, many of these harms were illegible to or even occluded by the state. Somali women were aware that mould and the health conditions it caused were, by contrast, starkly visible and evidenceable through photographic and video documentation, environmental surveys, and biomedical reports. As such, we suggest in this paper, they mobilised mould to hail the state in Lisa Mitchell's formulation, rendering visible and pushing back against a wider set of classed, raced, and gendered forms of structural violence. Taking the experiences of our Somali interlocutors as a case study, we're interested in exploring the ways in which Somali mothers use the materiality of their homes and their bodies to make claims of the state. Our account can be read alongside a number of examples. Oh, we'll just go straight here. A number of examples. Sorry, 1 second. Our account can be read alongside a number of examples in the ethnographic record in which marginalised people mobilise the materiality of their precarious homes to make claims of the state. In such accounts, people who are excluded from recourse to democratic organs hail the state through, for instance, cladding and debris from fire, refused and hoarded objects, broken pipes and heating systems, or toxic substances like formaldehyde or lead. These materialities become complex symbols that are used to frame residents, in Catherine Fennell's words, as, and I quote, the victims and perpetrators of the ruin that engulfs their buildings, end quote. This paper shows that mould, like these other materialities, is also used in different ways to reconfigure the relationship between the house and the state and its most marginalised subjects. In this paper, I will begin by introducing mould as a material substance that might be situated within larger conversations around toxic activism. I will go on to locate mould in the regimes of racialised housing provisioning that characterise Birmingham. I'll then follow mould through a number of encounters as it is mobilised by both housing and environmental health officers and by Somali women themselves to renegotiate relations between the state and welfare recipients. Biologically, and here I think Jen can probably give this a little bit much better than I can. Mould refers to many thousands of species of fungi comprised of thread-like multicellular structures termed hyphae. Unlike other categories of fungi, mould never forms complex fruiting bodies or mushrooms, but instead its hyphae cohere to form creeping mycelium. In houses, mould growth is associated with excess moisture and poor ventilation. This troublesome water might come from an outside of a home caused by structural damage, such as leaking pipes, rising damp in basements or ground floors, or rain seepage because of damage to the roof or around window frames. It might also be caused by moisture or condensation from within the home that doesn't have anywhere to escape to. Moisture comes from inside the home through bodily substances, sweat or breath, or from cooking or showering, or from using products such as incense in the home. Here, the sources of moisture that cause mould are generated by the very bodies that become afflicted by the spores from mould. In damp environments, mould grows and emits spores, cells, fragments, and volatile organic compounds, polluting indoor air. Molds produce allergens, irritants, and at sometimes toxic substances. Inhaling or touching mold spores may cause an allergic reaction, such as sneezing or runny nose, red eyes, and skin rash. It can also exacerbate existing dermatological autoimmune conditions, such as eczema. Molds can also cause a range of respiratory conditions or exacerbate existing respiratory conditions, such as asthma or COPD. The public understanding of mold as toxic is fairly recent and can be traced to the hospitalization of 10 Black infants in Cleveland, Ohio in 1993-1994 with pulmonary hemorrhage. 3 years later, the first publications on the Cleveland cluster highlighted the water-damaged homes that infants lived in as a primary environmental risk factor, noting high levels of Stretobacterus chartarum, or toxic black mold, in their homes. As Alara Shorty suggests, mold was taken up in the US public imagination as symptomatic of a wider landscape of toxic threats to contemporary living. No longer confined to certain areas or communities, anyone could become a victim of toxic exposure, not just the poor and racialized. That was a quote. As suggested above in the UK context, such mobilization by middle-class, primarily white populations occludes the particular racial dynamics that surround mold, the question of who is exposed to mold, under what kinds of housing conditions, through which blame narratives, to what health effects, and as a function of which histories of marginalization. Indeed, following mold as material and metaphor can reveal the ways in which inequality is generated and reproduced in the intimate domestic world and embodied in the racialized body. Clearly, what is important to understand about mold is the way that it exists in an unwieldy assemblage between the materiality of a house, the bodies of those who live within it, and the bodies of those who live within it, and hence generates embodied inequality. As the geographer Megan Kane has pointed out of mouldy private and social tenancies in Glasgow, Scotland, mould blurs the edges of the home, showing the simultaneous porosity and permeability of both the boundaries of the house and the boundaries of the body. It is a matter out of place in Mary Douglas's formulation that, as Elizabeth Roberts writes, gets inside and becomes entangled with bodies and homes, dissolving their limits and boundaries. For those who live in the sacrifice zones of capitalism, however, entanglement with toxic substances like mold can have political potentialities. They can act as what Gabrielle Hecht calls interscalar vehicles that can be deployed to, and here I quote, make political claims, craft social relationships, or simply open our imaginations, end quote. Put another way by Vanessa Agar-Jones, one can see the racialized body as a site of interaction, using Karen Varad's formulation, within wider systems of global capital, by which those excluded from other activist fora are able to make claims of the state with and through the substances that they live with. As scholars of toxicity have shown, people who have been abandoned or neglected by state welfare systems or are unable to hail the state through other civic means might mobilize toxic substances to make claims of the state. The claims that people make of the state through entanglement with toxic substances, however, are a critical but risky political currency, as Catherine Pennell argues in the context of the Horner social housing projects of Chicago. This is because they turn on the legal and sentimental claim that such exposures are injurious for anybody. The universality of these claims, as refracted through a swirl of legal, biomedical, and policy discursive regimes, risks occluding the specific historical forms of marginalization that lock people in toxic spaces in the first place. As Pavrita Vasudevan and Sarah Smith argue, it is not only the explicit political narrative accounts of such peoples that ought to count as activism, but the everyday domestic struggles. Vasudevan and Smith make clear that the labor that is generated by toxic substances in the domestic sphere is political, and as such should be explicitly incorporated within concerns for toxic activism. They argue that living with toxic substances is not simply a form of suffering or survival, but might be seen as a domestic geopolitical praxis, for they write, and I quote, "Ruins are also the site of refusal of the life-degrading presence of the infrastructure of state racism." Before we turn to these domestic struggles, let me situate them in a longer history of racialised housing policy in the UK.
Sorry, everyone, for this awkward thing that I can't make disappear.
That's all right.
Just keep moving it around. It doesn't.
The Somali diaspora is currently the largest African diaspora in the city of Birmingham. Many Somalis in Birmingham and beyond settled in the UK following the Somali Civil War during the 1980s and 1990s and following state collapse. Most of these early asylum seekers were granted refugee and later citizenship status in Europe or the UK. This initial movement was followed by a number of waves of migration of Somali refugees since 2000, where Somali people with European citizenship status have relocated to the UK from countries such as Holland, Sweden, and Finland. Whilst the citizenship environment in the early 2000s was seen as comparatively welcoming, over the course of the last decade, as the British state has been rolled back through successive campaigns of austerity and introduced hostile environment policies, the experience of Somalis, whether citizens or EU residents with settled status, has become more precarious. Many Somali women explain decisions to relocate to Birmingham, and specifically to the inner city ring, as being predicated on knowing relatives and friends who had established themselves within the ward. Whilst in many ways the establishment of Somali families echoes the welfare context which had shaped the establishment of Pakistani and Bangladeshi communities in East Birmingham 4 decades prior, many women arrived in the UK under refugee status, lacking any formal right to work and in a context where state support, including with housing, had vastly diminished. Right to rent checks and a wider context of Islamophobia in Birmingham contributed to the decisions of Somalis to rent on the private market, with contracts in eastern Birmingham often being brokered with local agencies, which explicitly targeted migrant groups who did not speak English, since, as one housing official told us, and here I quote, "They're the most vulnerable and they can absorb the money out of there, and the support network around them isn't big enough for them to do anything about it," end quote. Post-COVID-19, with monthly rental rates in the city skyrocketing, many have been subject to contract terminations or, on occasion, forceful evictions from landlords. In some cases, Somali families have simply returned to find themselves locked out of their homes. Sometimes women were evicted by private landlords because they complained about states of disrepair. The houses that Somali women lived in inner city Birmingham were in such states of disrepair due to decades of government housing policy that intersected with decades of racialised zoning laws. As across the UK, council policies featuring limited home building and the promotion of the right to buy public housing since the 1980s have been accompanied by a chronic underinvestment in existing housing stock. This has led to widespread structural disrepair across council properties, quality issues which have only deepened following the entrenchment of conservative austerity policies since 2008. Indeed, Birmingham represents an urban epicentre of the UK housing crisis, a condition that is only predicted to worsen following the council's declaration of bankruptcy earlier this year. Available supply is woefully inadequate in view of demand, and total stock has fallen from 120,000 units in the 1980s to about 60,000 in the present. Furthermore, social housing in the city is characterised by an aged and poorly maintained selection of dwellings, consisting largely of Victorian-era homes acquired by the council pre-1919, or interwar purpose-built flats and houses. Recent austerity-driven policies have seen council provisioning outsourced to or mediated by a web of private landlords, subcontractors and providers. With social housing policies increasingly driven by profit rather than need, houses across the inner city have been subdivided into flats and temporary forms of accommodation. As across the UK, families needing homes across Birmingham are confronted with insecure and substandard options. Considering the diverse migratory histories associated with Birmingham since the post-World War II era, a more complex picture of racial inequality emerges that undergirds this housing crisis and the question of who lives in what kind of home or who might be exposed to mould. Histories of provisioning have served to locate migrant communities within the age stock of the inner city. From the 1960s, white social tenants tended to be placed in better quality stock located in Birmingham's outer hinterland. Caribbean communities were located in the northwest of the city, and South Asian communities were homed in the eastern corridor. Drawing on business connections and social infrastructures, South Asian migrants gradually upgraded the obsolete houses provided by the council, purchasing dwellings at a discounted price under the 1980 Housing Act, introduced during the Thatcher government. Following legacies of intercommunal struggle, South Asian communities have today established themselves within local council structures, as well as overwhelmingly representative of the war's landlording class. They rent this housing to new migrant groups, including Somali migrants, who pay rent through a combination of private funds and government housing benefits. The struggle between tenants and landlords over mould revealed a tension in the meaning of the home and the kind of threat that mould posed to it. For diasporic landlords, housing was a speculative property asset that afforded them secure citizenship. As such, mould was a threat to accumulation and social status. For Somali women, providing a safe, secure home as a site of social reproduction was their moral responsibility as mothers, a responsibility that was particularly important given their own childhoods characterized by traumatic protracted displacement. As such, mould was a threat to life and futurity. It was a source of daily domestic struggle, as we will see in returning to our story. The first thing we noticed when I crossed the threshold of Awa's house was just how fastidiously clean the place was. The next thing I noticed was that the windows were open, letting in a chill that pricked my skin. I would come to learn that Awa had been told by her landlord to keep the windows open to stop the mould growing. As we heard in the opening of this paper, Awa moved into this privately owned 3-bedroom house with 7 of her 8 children, who were between the ages of 3 and 18, 3 years ago when she migrated from Sweden. 3 of her boys sleep in the master bedroom. Her 18-year-old daughter sleeps with her 3-year-old sister, and her 2 5-year-old boys and 13-year-old son share the 3rd room. The 13-year-old, who is also autistic, however, has been so sick with asthma and eczema that she spends most nights sleeping on the couch with Awa. The autism, and here I quote, is the will of God, Awa told us. But the link is between the eczema and the damp. Like now it's summer and there is no damp and the skin is better. The landlord would say to me, it's because I wasn't opening the windows. But it's the middle of winter. Why would I have the windows open? End quote. While it might be clean on the surface, the house is in disrepair. Awa took us on a tour. In the living room, she showed us cracked windows and seep holes in the brickwork. In the kitchen, there was a gaping hole between the benches where the gas cooker was meant to be. But last year, she told us it has exploded. Boom! She gestured to the ceiling. She took us upstairs into the bedroom, where vast blooms of mould crept from floor to ceiling. My son can't sleep in that bed anymore, she told us. He was getting sick every morning. The bed next to the mould was unmade. Awa had complained to her landlord multiple times, though had always paid her rent during the 3 years. Sister, just wipe your walls, the housing agency told her. In the meantime, she said, she had become a handyman, washing it, wiping it, painting over it, fixing seep holes with grout. When I arrived from Sweden, she told us, the house was painted freshly white. I didn't understand what was behind that. The images of my son's skin will never leave my mind. She has been on Birmingham City Council's emergency housing list since November 2021. When she complained to the council about the landlord, and she got a knock on the door from her landlord's son. Sister, he said, why would you file a complaint against us? We're Muslims. Awa told them, I'm a Muslim too. Why didn't you help me all those times I asked? My children could die from this. Awa's house was making her children sick. The deteriorating material condition of the home was metonymical with the deteriorating condition inside her children's lungs. She felt shame that she was unable to provide a safe and secure home environment for her children, a key responsibility of women in Somali culture, who are traditionally responsible for building and maintaining houses along nomadic routes. But she also felt angry at the responses of landlords and the council, who just told her to wipe the walls. Like Awabi Shak's parents, when Somali women like Awa approach housing authorities with problems related to mould and disrepair, they've been told to stop cooking rice, to open a window, to paint over it, or in the most racist of cases, to stop ritual bathing, burning incense or oud by landlords and council officials. Most intimately, officials situate the responsibility for mould in the racialized cultural practices that surround the maintenance of the body and social reproduction: washing, eating, laundering, child rearing, cleaning, and even breathing. The very practices that the body requires to survive. An official from a neighbouring council in charge of building maintenance was highly aware of the prevalence of mould and damp among the housing stock. He explained, once it's in, it's very difficult to remove. It's very difficult. If there's mould, even a fleck of mould on anything in the property, and you move it to another property, it grows and grows. You can clean it with bleach, but the black spore mould will grow again. Despite this knowledge, such issues had only come to the attention of West Midlands councils, in part following the outrage following Ishaq's death. Conditions of austerity had produced a reactive council. Mould and damp was previously deprioritised, with slashed budgets diverted instead to other agendas mandated by national government, including fireproofing in the aftermath of the Grenfell tragedy and later decarbonisation initiatives in line with green energy policies. For this employee, budget cuts and growing case numbers warranted a hands-on approach, one that is empowered by the new Social Housing Regulation Act. Council members began knocking on doors of tenants' homes. These interruptions to the home and the performance of covert checks brought individuated and racialised ideas of blame into the homes of Somali women, rather than new rights for claims making on the part of tenants. These intrusions were experienced by Somali families as violent incursions of the state into their intimate domestic space. Women felt worried that their children might be taken away and were constantly stressed by rules that mandated where children could play. One woman explained that she had been reprimanded for leaving a pram in a common space. In some cases, such fears were realised by council officials who took seriously their powers under the hostile environment Home Office approach to interrogate the migrant status of those that they encountered. Indeed, these encounters confirmed for women that domestic was a site of colonial state discipline, and housing policies were an extension of a wider set of internal bordering technologies. The council employee explained his approach to attending call-outs. Here I quote, "When I've been out, I educate as I'm going. As I'm doing the inspection for mould, I'm also flicking all the trickle vents open because 9 times out of 10, it will fix the problem. I'll be poking around. When's the last time you opened the windows? And I do go round because you can tell if someone's opened or not, so don't lie." End quote. For him, the problem was increasing in part because of occupants' failure to adjust to high-quality repairs. And I quote, "Energy prices affect a lot of people, so that when they get new windows, we fit like a good quality window. So whereas before, I've noticed a lot recently, a lot of the windows we fit in a couple of months later, they're getting mouldy. Yeah, because we've gone from having a sort of passive airflow through poorly old windows to then having a seal, so there's no ventilation. We do get a lot of people giving us a few choice words because we're telling them it's the way they're living." End quote. Yet despite recognising mould as aggressive, he quickly located blame within occupants' daily living activities. Here I quote again, I've actually worked on the damp team for several years back in the day, and some of it's to do with the I probably say 10% is to do with the condition of the property. 90% is the living conditions in which people are in. So a lot of it's because they're not opening the windows. They're not opening trickle vents when they have the heating on. They're drying clothes on clothes horses. This might sound silly, but they're not opening windows when they're mopping, end quote. These understandings reproduce widespread practices of blaming mould and damp on practices of daily living, which echoed through government advice. One housing association pamphlet advocated the chief means of preventing damp and mould was produce less moisture. While these quick fixes might be motivated by council officials and workers who are themselves under pressures of austerity regimes, these dynamics of blame perpetuate a cultural logic of individual and even embodied self-responsibilization. Here, the way in which mould is attributed to the individual resonates with Lauren Ballant's definition of the biopolitical, where a hegemonic bloc organizes the reproduction of life in ways that allow political crises to be cast as conditions of specific bodies and their competence at maintaining health or other conditions of social belonging. Thus, this bloc gets to judge the problematic body subjects whose agency is deemed to be fundamentally destructive. In the Somali case, this self-responsibilization occurs at the level of both the home and the body. Tenants are accused of failing to adequately ventilate their homes, creating a closed system in which daily activities produce moisture, which lingers and coalesces, leading to damp. The damp degradation of buildings in turn produces a fetid miasma of organic and inorganic toxicity with a wide-ranging health implications. This water is charted through various physical states in a closed system by which the embodied tenant is held responsible for their own bodily harm. The bodies produce moisture, the moisture creates damp, the damp breeds mould, the mould pollutes the air, the bodies breathe the air harms the bodies, and the damage is done on the bodies, and the bodies are to blame. As I've tried to. In the Somali case, the attempt to make a claim against the state for adequate housing in the wake of resettlement and protracted displacement is met by different forms of blame. When mould erupts into the homes and bodies of Somali families, blame narratives are used to shore up the racialized boundaries against such bodies by dominant groups like landlording classes and council workers. Acts of blame render the co-substantiality of the sick black body with the mouldy house, as the environmental historian Linda Nash puts it, an important arena for the ongoing construction of race and racial ideology in the UK. But critically, and here the paper turns, Somali women did not internalize or accept these forms of blame. Instead, they pushed such blame back on a system that has and was neglecting them and their legitimate needs. Somali women linked their experience of blame to the fact that their bodies themselves were stigmatized as unproductive, unwanted citizens within a post-colonial state that is hostile and even violent to all refugees, even after resettlement. One woman tutted, "People just think of Somali people as in big clothes with lots of children. This is why they're blaming us." Somali women directly called out the racism implicit in disciplining cultural and religious practices of social reproduction and care. Chief among these suspicions is that the state is attempting to control the number of children that they have. Somali women push back against the supposition that children are an economic burden and see them instead as a gift, such that having many children is a source of joy, but also respect for middle-aged women. They also link this blame to their positionality as refugees, who are assumed to be dependents on the state. As one interlocutor, Ayan, put it, they don't give Somali people chances. They don't see them as valuable. They always see them as refugees, just taking everything. There's the idea that they can't prosper no matter what, because we're always going to be refugees. We're always going to be takers. We're not going to be givers. Indeed, the metaphor of a prison and the themes of punishment, invasion, colonization, and death came up again and again in our interviews about housing. Women felt that they were being punished for asking for support from the state because of their race and their religion. They lived between state abandonment and state surveillance, where the house was both neglected by the state and was a source of control, through the presence of managers, inspection officers, and private landlords threatening eviction. The home, which was meant to be a space of well-being and wealth, became an image of shame, humiliation, and state intrusion. Mould played an interesting role in the attempt to push back against this wider ideology of undeservingness. It was so important for Somali women to show and collect evidence of the mouldy conditions of their houses and the impacts on their children's skin and lungs, because such evidence rendered visible the wider structural and historical processes of marginalisation that Somali women had experienced at the hands of the British state. As the anthropologist Didier Fassin notes, communities who are mistrusted by the state, like asylum seekers, like Somali women, are required to draw on their own bodies as sites for the search for truth via traces proving persecution. Most forms of persecution, however, leave no trace and are hence invisible. No claim can be made from them. The mobilisation of mould and of the black body suffering from its toxic effects is a means by which Somali women sought to render visible and legible structural and historical forms of suffering otherwise ignored by the state. We were called upon to see, record, video and photograph the conditions of poor houses that women and their children lived in. We were also called upon to see the bodily marks, rashes and scars, and to listen to the wheezing chests and coughing infants. Such witnessing was a multi-sensory exercise. We were invited to touch and smell the atmospheres of these homes and to feel the effects of such environments on our own bodies. We often left these homes with aching heads. We wondered, perhaps from our own exposure to mould for short periods. In these instances, women were mobilising their homes and their bodies as sites of evidence. Mould was proof of the racist orientations of the state. It revealed in material terms the ways in which state provisioning, or lack thereof, was causing the slow death of the Somali diaspora. Somali women sought recognition and even compensation for this slow death. This was put most clearly by Fatima in another visit to the temporary house that she was living in with her 6 children. Fatima had moved into the house when she was evicted from her previous home by her landlord, who cited that his son was getting married. Fatima's house was on a busy Birmingham street, and when we arrived on her doorstep, we were greeted by her teenage daughter, who was wearing long marigold gloves. "I'm cleaning," her daughter exclaimed as we entered through the door. Fatima's daughters, were always cleaning. Like Awa, as soon as they scrubbed the mould that ran along the edges of their skirting boards, crept along over the whole walls of their kitchen, and spread grimly along the bathroom tiles, it would reappear. As she showed us around the house, Fatima was in tears recounting the ceaseless labour of trying to make her house livable. But we saw windows dripping with condensation, great gashes in the plaster of rooms that were surrounded by mould, and gaping holes in the roof. Her 2 daughters said that they were ashamed to bring their friends back to the house. When they went on FaceTime, they would huddle in the corner of the room that had patches of white wall, so their friends could not see the condition of their house. It's like they just threw us away," she sighed. "It feels like they're punishing us," Fatima said as we sat in her front room. And here I quote, "When I asked to see the house first before moving in, they said, no, you don't have a choice to take it or not. That's why I said I feel like I'm being punished. They brought me here like a prisoner seeking help. I feel like they owe us diya. How could they move us in and not check the dam and give us no one to contact if things go wrong? They brought us here and they have a duty of care for us. Any more that's worse than it would be a story about our deaths." Perfect. Diya is a Somali concept that is akin to blood feud or compensation. As the anthropologist Jatin Dua explains, Diya payment groups are central to wider questions of compensation within the juridical world of Islamic fiqh, I'm saying that wrong, and its modes of restitution and retaliation, where the category of diyat, or singular diya, denotes a non-punitive socialized mold of dealing with mold. A non-punitive and socialized mode of dealing with harm. Dua points out that in contrast to Western legal frameworks, Diya blurs the boundaries between civil and criminal legal realms, as well as distinctions between crimes against individuals and crimes against the state. The system shifts the locus of responsibility for adjudication and liability from both the state and the individual towards the community. Here we see the invocation of Dia in the context of wider narratives of blame as performing particular relational work. The blame narratives of private landlords and council workers aim to marginalise Somali women by pushing responsibility back onto the individual. In contrast, the act of blaming the state on the part of Somali women does not simply reassign this blame to the state, but distributes obligations to forgive and to pay within a broader social universe. Seeking compensation is a way of seeking a relation of obligation, belonging, and care with the state, where such a relation has been denied. It is a claim to the belonging and fruits of citizenship that have been refused to its colonial subjects. Come to a conclusion. As the anthropologist Georgina Ramsey has argued of the Australian context, the experience of violence at the hands of the state does not stop with resettlement. Instead, sometimes, to quote Ramsey, sovereignty is imposed through the very processes designed to resolve their displacement. Our project and its focus on housing is part of a broader move to think about the extension of such hostile environment policies aimed at bordering and policing those refugee and migrant groups to people who are citizens or have legitimate migration status. Indeed, we see a synergistic slow violence released through the quality of accommodation provided by the state or its private contractors to those on council housing registers. Mould becomes a complex symbol in this expanding hostile environment. On one hand, it renders hostile environment policies material in the homes of those who are not deemed by the state fit to be recipients of welfare as a result of their race, migration status, or cultural practices. The narratives that surround Mould work to blame such people for creating the very conditions that make them sick, pushing responsibility for harm back onto individuals. On the other hand, however, in the Somali case, blame for Mould is not internalised but pushed back against. Mould is proof for Somali women that the state has not fulfilled its obligations. They experience anger rather than shame as a result of this unmet responsibility for care and the necropolitical orientations that they encounter. The act of refusal is not direct or dialogical. Instead, Mould becomes a way of making a claim to belonging and citizenship against a racist state. This paper takes Somali women's experiences as an example of such claims making in a particular post-colonial regime. I hope that in the discussion we can think comparatively about how claims are being made in other settler colonial contexts like Australia.
Thank you so much, Nikita. That was brilliant. I think it was a really good example of fantastic anthropological research where you just get right inside the house, the wall, the lungs, and there is so much to think about and talk about there. But let's go to our discussants first before we open it up. But please do online and in person, just take note of your questions. If you're online, please do pop them in the chat. We've got some already, but let's keep going with that. Jenny, what would you like to?
Very compelling. I'd like to say amazing, but not so much for the Somali woman model. And a disaster at that with policy as well as because I'm probably going to have nightmares about mould in a different context tonight because that's horrifying and it should not happen. Yeah. And if you look at those walls and you can actually imagine them as your lungs coated with those, like the walls are in your lower airways, and that's devastating. And to some extent, it's a silent bioterrorism, if you think about it, because of the, anthrax bacterial version that forms spores. Here we have spores that are being formed as well and released on an ongoing basis to these poor recipients. But if I can actually highlight how important mould is from an allergic perspective, with my background in allergic diseases, whenever you hear about seasonal allergies or hay fever, you think about pollen grains. And The pollen grains, I know that they're devastating in temperate climates like Australia, like in Melbourne. But even though we don't see them, they're actually quite large. So they're actually more of a problem of the upper airways. But nevertheless, it can actually translate to a more deadly form, which is anything to do with the lower airways is more deadly. And that's what happens in my thunderstorm asthma, where in a thunderstorm, the pollen grains rupture. They go from a larger entity to a smaller. So our airways are essentially like a filter, different stage of filter. So we've got the upper airways. Don't forget, allergies also contact in your eyes. So you have itchy eyes, allergic rhinitis, which is the upper airways, and then the lower airways. So the pollen can actually cause the deadly form of allergic disease, which is associated with asthma, allergic asthma. The reason why I wanted to explain that, the mould, with their spores being so much more smaller, they're always a lot more dangerous ticking bombs. So we've had those 10 people in 2016 die, 10,000 people seeking medical attention. The doctors didn't know what was going on. Our health system was at a brink of collapse. They didn't know what was going on. Some of my colleagues from the Alfred Hospital said, because I had a stint there, this must be Jenks, thunderstorm asthma, so they could actually attend to them. So that's for the pollen, which doesn't happen all the time. So if an analogy with fungal spores and these people getting exposed to it all the time is always there to gain access to your lower airways. So that is being breached all the time. So that's why these poor children and adults are always suffering from respiratory as well as eczema, flaring up their autoimmune diseases and what have you. And that's just allergic context. There's all these other toxic materials that are coming. And I was reading a publication recently that some indoor mold can also grow in the moist cell linings of your airways and also breach and go and affect your brain and cause neuroinflammation as well. So that's why I think that this is needs to be addressed. There should be, and the question I was going to ask you, Nikita, is that are there any policy requirements where indoor quality can be assessed and the status of the inhabitants' allergy and asthma can be established as well, maybe before and after, just to make sure that you know exactly what is going on in the air as well as with the sufferers.
Should I answer now that question? Sure. It's really interesting. Wow, I mean, it's so interesting to have your reactions, Cenk, because it adds a whole nother layer of reality, right, to this kind of situation, and to work together, you can scale up and down the structural, right, to the kind of intimate body. To answer your specific question, I think so after the death of Awabi Shak, there was a shift in, there was a big public inquiry, and that resulted in a legal shift to the introduction of what was called the WABS law, which is a legislation that empowers local authorities to kind of come into people's houses and assess the quality of indoor environments in a more systematic and a kind of comprehensive way in social housing, not in private housing. At the moment, I think just last week, they were doing a bill reading of the adoption of those kind of legislative processes to private tenancies. So there is movement in the UK, which is really good. But I suppose what I'm trying to make visible here as well is the experience of that kind of interaction with the state. So for a Somali mother, the state is the same thing, right? Like the same state is not providing them healthcare, is not providing them a secure house, and is coming into their homes, intruding and trying to assess things. So, and often, even if the legal framework allows for, it is kind of on the side of the tenant, because Somali women don't have the kind of social infrastructures and to be able to make those claims in the first place. They experience those as intrusions of the home when environmental policy officers. So we ran a public conversation around this. This project was a real impact kind of activist project. So we ran this big public conversation at SOAS, and we had an environmental health officer who came to like just join as a member of the public. And he was saying that even if you change the law, the enforcement of that law at local authority level is so poor because local authorities are so, particularly in the areas of poorest housing, are so stripped out of kind of service provisioning in the UK. The austerity has hollowed out local authorities so much that there's actually no point in trying to make a claim of the local authority. You should just go straight to court. Mm-hmm. So he was like, I don't even bother telling people, he was had gone into private practice, right, to give evidence in these kind of court hearings. He was saying, I don't even tell people anymore to try and call up the council. I just tell them to seek legal advice. But in that happening, a whole kind of landscape of no win, no fee compensation lawyers have kind of sprung up around in this kind of lower echelon of housing, of legal claims making around housing. So yeah, it's a policy nightmare, but the fix of the policy nightmare is investment in local authorities and good housing. It's so yeah, and a kind of deeper, it's really, really hard doing this activist work to engage the housing people in the local authority. It's really easy to engage the public health people. The public health people, we've talked at so many local authorities, public health teams across London, in Birmingham, etc. They all come to all of our events. They're like, please give us this evidence. They'd love your work, but the housing people are much more difficult to engage because the answer is like, I don't know, nationalize housing, stop having private properties.
Yeah, because obviously the health of these poor Somalian demographics is going to impact on the general healthcare system, isn't it? Exactly, and it's a domino effect where it's going to it's not going to just sit there and be contained. Yeah, absolutely. In suffering. Yeah, so,
which is what that Mould is political film is about. So it's a really good film, actually. You can find it on YouTube. It's New Economics Foundation.
Yep, so, definitely. We'll watch it.
So we'll go to Marty now.
Thank you so much, Nikita, for such a compelling paper. I really enjoyed thinking about it and trying to think with some of the work you're doing. I want to talk about a couple of things. I think one thing that I found really interesting about your approach to mould is sort of moving away from what I think has been happening in a lot of sort of multi-species anthropology about fungi as this sort of generative allegory for how we can live in the ruins of capitalism, to this kind of dark side of the fungal world, which is mould. And I know you mentioned entanglement a little bit in the paper, particularly in the way that sort of scholars of toxicity have been using it. But I really appreciated that wasn't the principal way you were thinking about people's relationships with mould. I feel that entanglement has this, can kind of give this sense that we're talking about something in an apolitical way, or like this kind of apolitical agent of non-human others that we become entangled with, which is not how mould figures here. Lately, I've been thinking about whether if entanglement can't do some of the political work that we need in this kind of context where you're using mould as a way into thinking about these broader structures and kind of political economies and how they bear on people's bodies. Like in my work on invasive species, I've been thinking about seeping as a different kind of analytic than entanglement. I'm not really, I haven't fully fleshed it out yet. I'm not really sure if it can do this kind of political work I want it to, but thinking about getting closer to the material ramifications of these kind of difficult non-humans. Because I think seeping can kind of get towards something intractable or sort of the overwhelm that happens with mould. But yeah, I wonder if there's something you can think about more in like a more kind of explicit pushing back against that literature on fungi. Because I think we're doing something really interesting here with that. The kind of other thing I wanted to talk about is just the resonance between these problems with housing in the UK and social housing, particularly in remote communities, remote Aboriginal communities in Australia, where mould is not necessarily the issue that people have, but it's things to do with overcrowding or just houses in total disrepair, just a lack of state care and investment. And I think in both instances, these houses sort of function as a way to think about how little the state cares for people who are racialized in particular ways. Thinking about anecdotes of housing, the state of housing in remote Aboriginal communities, and how when people do kind of make these claims on the state that the houses are overcrowded, or like this case of this woman who lived without a front door for 10 years that's just been through the courts kind of recently. The state's argument is sometimes that Aboriginal people don't need their houses to function in the same way as mainstream Australians. Yeah. And so this kind of, this sort of state abandonment is sort of held up as appropriate because they're saying people don't want to use houses in the same way. Yeah. And I feel like there's some sort of loose resonance there between the kind of apportioning of blame that the state is doing. Yeah. Or the way that these families are using these houses as a way for them to assume responsibility. Yeah, and as you so rightly say, these women are living between state abandonment and state surveillance, which also recalls to me some of the kind of work that Eve Vincent has been doing with her recent book, Who Cares, and her work about people living on welfare in Australia, sort of caught in the same, in a different context, those same sorts of ways of being abandoned and surveilled. But, kind of a network of, or sort of framing of the state delivering care, whether that's through housing or through welfare. I don't have any specific questions, but those are just kind of some of the ideas that your work provoked.
Thanks so much, Marty. And I particularly appreciate the first one because it was in an earlier version of this paper. Me and Liz, my co-author on this paper, reviewed all of that work on kind of toxicity and fungi, and we were like, this is nothing like what mold is like, right? It's like a totally different. So maybe that kind of needs to go back in there, and it takes another form. But I particularly appreciate the second point because one of the reasons I'm here is because when I was doing this work with the Somali women about a year ago, my brother is actually, I think I've told you, Emma, a lawyer at Naja in the Northern Territory, and he does a lot of work on housing and repair and claims making in the Northern Territory. And he said, those processes are similar to what I see in the legal clinics I'm running, and how people are trying to make claims of in conditions of disrepair. So I'm here because I'm also working with the Sydney Policy Lab to try and think about if there's a larger comparative project between different regimes of coloniality and housing, and if you can think across the UK and Australia as two different contexts where different kinds of policies converge to produce particular experiences of housing distress. So if anybody has any thoughts or steers for me, this is a kind of expansive moment of thinking if this is feasible or interesting, or if I'm the right person to do it or not. As well as in resettlement context in urban situations in Australia, is refugee communities like the Somali community in Birmingham. So, thanks.
Thank you. Thanks, everyone, both to our discussants and these. So we can open questions now. I have some, but I want to see if anyone else here would like to jump in.
Yes, yeah. I actually have one question. You just mentioned in your paper as well that this Somali lady, she was on the emergency housing list of the city council. Yeah. So what's the living situation, the living conditions, the local public housing? Are they the same, or are they better than this?
It's a very good question and a very complex answer. We also have another paper that's now under review at the moment that's specifically about tracking people, how people experience tracking between different kinds of housing regimes. So often, and it tracks out that cycle. So basically, often they will be in a private house that's owned by a private landlord, then the rent will go up, or they'll make a complaint about disrepair and they'll be evicted. So at the moment, there's still in place Section 21 eviction notices. So you can be evicted without any reason, basically. So you get evicted and then you become statutorily homeless, and the council has to house you, right? Particularly if you have children, that you're statutorily homeless, so you get put in a temporary accommodation. So most of the women I met had lived in a travel lodge, like a hotel room with, 5 children in one room, one of whom is autistic, then they've lived in a temporary accommodation house, which is like a council-owned house but it has like the strappings of a kind of surveillance environment, so like fire doors and, it looks like a surveilled government house or something, rather than somewhere you can't take anything down, you can't change the furniture or anything. Then they have to go on to this online bidding system. And the online bidding system, you like put in your details, you might stay on that list for years and years, right? And then you get placed in a house. And often Somali women have large families, right? So it's really hard to find a house that's big enough for them. So they'll be in temporary accommodation for years, when temporary accommodation is meant to be really short term. And then they might get finally placed in a social house, but often that house is owned privately, but then rented to the council to be rented to a person because of the right to buy policies, which meant that councils sold off loads of housing, right? And don't maintain it. So if they're in a council-owned house, it's sometimes easier to get repairs done. It's harder to get repairs done when the house is owned by a private landlord but then rented back to the council. So there's a big problem of like a demand for that social housing, right? So the price per night goes up because the Home Office also wants that social housing to resettle refugees. So there's kind of like temporary houses or hotel rooms that are going for hundreds of pounds a night, where the Home Office is against the local authority because they have an obligation to house somebody. So, yeah. Once you scratch the surface, it's like, it's crazy.
I'm privy to any information, like even in Australia, in a private rental market, that landlords who there is actually visible or invisible mould issues, they actually detest and don't want to get it fixed. And so there are actually emerging indoor quality firms which actually provide the quality of the air, and they can actually give you estimates of number of mold and fungal spores in the indoor, so that it unfortunately has to go through the legal framework. So that does actually happen here in Australia, and particularly in Melbourne, that I'm privy to that sort of information. So even though we have quite nice and solid policy and what have you, there's always going to be these. And then obviously the legal framework has to come to the rescue.
Because you'd be the ideal expert witness.
Exactly. That's what happened at one of the inquests that was held.
I wanted to ask, I suppose leading on to this, the privatisation part of it is super interesting. So this is like the Tory government trying to say, everyone can be homeowners. We want to get rid of this, small state. We don't want such a big state. But also all of these Pakistani and Bangladeshi and Indian migrants can buy their own flats, basically. As written about in many of this incredible literature of the Indian diaspora in the UK. But and now, as you're saying, they're private, or whether they're leased to the state or not, it's private housing, and it's very hard to regulate. So, I mean, you mentioned the role of Islam in this, because the landlord's saying, why would you want to report me to the council? And I wondered whether there is a duty to provide a safe home, whether there is some basic basis in Islamic law or tradition that either the Somali women are appealing to, because that seems like another layer which is quite interesting. But, and I suppose just adding on to that and introducing a kind of reflection on the Australian housing system, and Tess, our colleague Tess Lee is a really good person to talk to there, and also Paul Mehmet in Brisbane. But I do not know from Aboriginal Public Health, and actually my first book was based on an ethnography of a Indigenous Public Health Research Institute, and the group that I was working with was actually Housing for Health group within a public health research institute, so in the majority of, say, in the Northern Territory where I was working, Aboriginal public housing is within Aboriginal communities themselves, which are Aboriginal councils. So it's it's Aboriginal councils that are then responsible for the housing stock, which does again bring in a whole lot of really interesting dynamics as well. So anyway, that's my
Emma,
set of questions.
Thank you so much. Yeah, I mean, this question of what kind of duty is being called upon to which actor is a really interesting one, which I think our team is just scratching the surface of. So Dia is obviously a concept that we have been trying to think about what different claims are, and I think that the critique I have of myself in this paper, and the reason why we'd like to do a much bigger, deeper historical project that kind of underpins this more activist project is like, what claims, who is the state? So, and what bit of the state how are Somali women imagining the state in the present, in the colonial past, and what claims are they making on the state through what kinds of conceptual means or histories or relationalities? So I think your question about Islam is one such framework which you can think about, the insistence on the relationality with the state. So one other concept that Somali women used a lot was kadarka, and that we also write about in that other paper. So kadarka is like destiny. So Somali women would make really specific distinctions between what of their situations they called kadarka or destiny. So written, already written by like God's will, and those that they found state culpability for. So, and they made really specific. So one example is that they would say the autism is the will of God. The autism is kadarka, destiny. This part is I have to accept it. This is my it's my role as a faithful person to accept God's will. And so hence they had a framework for making sense of that, right? And making sense of that distress and that suffering. But this bit is not, this bit is the state is culpable for. And I think the reason I can't, what we'd really like to do, Liz and I particularly, is to do a much more historical long-term analysis of how different, basically racialized groups have interacted around housing over the last 100 years, because this place in Birmingham is also the site of all that really interesting sociological work, Paul Gilroy, Henderson and Kahn, all these kind of key geographic studies of race and inequality in Britain and post-coloniality and how it worked through housing. So we'd like to be able to understand who was making claims on who, and what did the state look like for those different groups and through what kind of policy regimes, to be able to answer that more specifically, but we need some money to do that.
I have a question. Yeah. Thank you so much, Nikita. I would say it's a great contribution in the literature of environmental sciences, health sciences, and social sciences. Particularly, I'm looking for climate migrants in Pakistan, and I feel like they are vulnerable people who are in mercy of government, and they just can't do about these things. And the issue you are trying to explore is very, I would say, underexplored, and it needs national and international attention. I have a question that you mentioned that from 1960s, there were other nationalities like South Asian, Southeast Asians, and some Caribbean nationalities who got settled in different in suburbs, which were particularly better, I would say. So, in this paper, there's a very fine line between health crisis, humanitarian crisis, or environmental crisis, or housing crisis, you can say. So I just want to ask that what is the policy? Like your approach is really good. Like you're defining the mold, the problem, and the stances, or like the approach you've used, ethnography, and you are quoting the stances of different women. So I would say that it means that the problem is has been identified and it's under consideration. I just want to know what is the policy framework of UK government, and I think it's a national crisis because it's being faced by refugees, so it's an international issue as well. So is there any policy framework from international regimes like World Health Organization or Commonwealth Fund or any other regime? And if it's so, then if UK government is neglecting the issue, then it means it can be reported to international regimes. So what are the policy framework, national policy framework and international policy framework on this specific issue?
Yeah, very interesting question. I mean, I think what we realized that dawned on us quite slowly in doing this work is that these Somali women have experienced two different sides of the state, right? They've experienced the migration resettlement process, and then they've experienced the housing and temporary accommodation set of policies, and they're run by different parts of the state. So the Home Office will run the resettlement process, and the local authority will run the housing. So they have different responsibilities, and often they're at odds with each other. But I think because often the migration people don't speak to the housing people, often those conversations stay very separate. But if you follow the life of someone who's resettled, and this is what Georgina Ramsey does in the Australian context, which is really, really brilliant work, that you can see how different policy regimes generate cumulative harm for someone as they, move across these different forms of dispossession. So my colleague Anna Linley at SOAS works on, and my other wonderful colleague Charlotte Saunders, both work on the migration side. So they're working in the asylum hotels and the temporary accommodations provided to new refugee migrants, which are often provided by the same people who provide temporary accommodation hostels, the same private contractors. So there's interesting continuities between the way in which this happens, but there's also interesting tension. So as I said before, you might have the same room in a travel lodge being bid for by the Home Office and the local authority, who are all trying to house a migrant group, which then pushes the price up. So there's kind of tensions within the arm of the state. And I suppose there's it's a very basic point that we're making, but that migration policies and housing policies are experienced continuously for people, particularly if you center their experience of distress, right? So, I mean, I'm an anthropologist of mental health. That's the thing I look at first, right? So the experience of mental distress for these women is not just because they live in a bad house or a mouldy house in the present. It's because they've experienced protracted displacement. They've experienced the hard border of the UK. They've experienced internal bordering policies through hostile environment, and then they experience the housing policies. So if you take an ethnographic approach, that's one person who's experienced all these things. Whereas if you take a social policy approach, then you might focus only on the migration or only on the housing. So
brilliant.
So it's a very simple point, but it's just
Do we have we've got a question?
Well, it's not really a question, but I think you will really appreciate this. It's Dr. Erica Martino, who Google tells me is the University of Melbourne Research Fellow in Healthy Housing.
Oh, fantastic.
Who has worked in the built environment industry as a designer, urban planner, and GIS officer in the private and public sector, And Erica says, I'm doing a study on racism, housing and health with tenants Victoria. Please reach out if you'd like to collaborate.
Great. Amazing. Amazing. Oh, it's like Hinge for research. Yay. Oh, I came here with this hunch, this must be going on in a similar but different way here. So
is this a digital hi-fi?
Yeah. Awesome.
Wow. I'm going to email you.
Well, my email's on the last slide, so and it's 53.
Great.
Yeah.
Incredible. Yeah, so I loved this paper and I love this discussion, and the it's a little bit like a horror movie, isn't it? Like these poor like young teenagers, daughters constantly cleaning off the walls, and they're constantly coming back. And and this wall and lungs parallel is just it's very haunting and scary. So you talked about the slow death, slow violence, which is a kind of anthropological concept which I think is extremely so Rob Nixon of the slow violence concept is really applies here. But you're also now then talking about these women who somehow are deflecting this violence, like even though this mould is growing in their houses, in their lungs, they're just somehow, and as you were saying in that really cool, horrible, but very well described kind of circle of blaming people for the state of their houses, and their bodies actually embodying this this blame and this suffering, but somehow these women are saying are deflecting that and turning it into anger. So you're exploring Dia as maybe the kind of catalyst, the mechanism that lets them deflect and kind of escape this cycle where they just become, their bodies become a place of violence. But is that what is going on? I suppose that'd be my final question and how do they deflect or resist, or however it is that they're disrupting this kind of neat and tragic cycle.
That's a wonderful question. Gets to the heart of the thinking at the end of the paper. The first question, the first part of it, one thing maybe you'll have an opinion on, and I feel really uneasy with the concept of slow death or slow violence. I'm not sure if it works here. Sometimes it feels heavy-handed, and I think in social science there's very little theorization of violence anyway, and there is, but sometimes it's often very particularly in geography literature, Liz and I find it frustrating that violence is under-theorized in general. So I suppose a question back to you and to everybody is, how ought we theorize violence here? Is it slow violence? Is it slow death? Is it necropolitics? Or is it something more like cumulative harm? Or I think that's something we feel really stuck on in this paper. But maybe you've provided the key for us in thinking about that in terms of how are people theorizing this violence through this kind of concept of Dia. I think what's really important about Dia is that it does a particular form of relational work. So where the blame narrative is individuating, Dia is collectivizing. So blame puts you outside of our community, and Dia insists on that community. Insist on being part of that community, because and that's appealing to a different kind of authority, a divine authority, in order to make that claim. So I think that that part of the answer to that is that it is an insistence of showing how Islamophobic the state is. Birmingham is a place that has experienced particular forms of Islamophobia, where it was a place of the Trojan horse scandal. I don't know if anybody's heard about that.
Podcast.
Yeah, it's a fantastic podcast, which is how I know about it too, but which was about how a school in Birmingham was basically said to be a place where Islamic ideas were being taught to students that were extremists. But it was kind of all, I don't know, in the podcast it tells you all about how this was a kind of total, in the same kind of way, a misconstrual or blame narrative that totally rewrote what was going on, and was the source of public panic. So there's a lot of fracturing between Islamic communities in Birmingham. Like, for example, Somali people don't go to the same mosque as Pakistani or Bangladeshi migrants, and also the other big difference is that there's different forms of political representation. So Pakistani and Bangladeshi migrants are strongly represented in. They've been here for much longer, and they are represented in local politics and in local social infrastructures, whereas Somali people aren't, and I suppose they have a very different relationship to citizenship or the state. And that's partly because they've been blamed for not assimilating, for not being ideal migrants. But I think it's a kind of classic case of colonial divide and rule, right? Where you say they're good migrants and they're bad migrants. And so instead of the good migrants being against the state, they're against the bad migrants. So I know certainly I come from a family like that. So, yeah.
Yeah, no, we are at time now, but yeah, that was such a great conversation, and let us thank Nikita.
Thank you everyone so much. Extremely helpful and rich. So you have my email if anybody has any other thoughts or interest. This is the very beginning of a piece of work. It's all been done through little bits of money from little bits of things. So we hope to build it out as a much bigger project, that hopefully has scientific engagement, legal engagement, and if you have any ideas for how that should be shaped, we're all ears. So thank you so much.
Great job.
Thank you. Thanks online, folks. Thank you.
Oh, yeah, what a great paper.
Oh, I really appreciate
Very
it.
inspirational.
Yes.
Oh, no.
Yeah, so how do you, as the science...
Yeah.